So hi, my name is Vicky. I'm the Strategic Health Facilitator in the Learning Disabilities team, which is part of Bradford District Care Trust. And half a day a week, I also work with the ICB as clinical lead for learning disabilities. So people with learning disabilities have a lot more health issues than the general population. There's lots of evidence and reports and research to show that people with learning disabilities die at a much younger age than the rest of the population, and often those deaths are from preventable and premature deaths. People with learning disabilities often have other health conditions, but there's also things like the reasonable adjustments that services need to provide to support those people to access the health services in the first place. We have our learning disabilities register, and we can pull off the data around people with learning disabilities who should be accessing breast screening and should be accessing cervical screening and should be accessing the bowel screening, and we can see that the uptake for those people is much less than it would be for the rest of the population. And sometimes that's because things like letters are sent out to people or texts are sent to people and they can't always read them. So they don't know that they're supposed to attend an appointment. People are often reliant on carers to take them to appointments, and sometimes people are sick or not able to do that. So there's lots of reasons why those pathways need to be a little bit more flexible. We've got quite good systems in place that sort of involve people getting a phone call to tell them that they're due for their bowel screening and checking whether they need any support with that and stuff. And we can see our bowel screening uptake has improved, and it's pretty much consistent with the wider population. We've linked in really closely with the self-advocacy groups, so Bradford People First, Keighley People First, Exclusively Inclusive are the Craven self-advocacy group, and we've done training sessions for women with learning disabilities. Penine breast screening unit staff have come and done sessions at Waddy Loves for women with learning disabilities around how to check their breasts. We've done sessions for care providers around what to look for if you're supporting somebody with a learning disability. We've got what's called a VIP hospital passport, which is a really easy to understand, accessible document that people take into hospital with them. They also can get what's called a red bag, which identifies that people need that additional support and that they've got a learning disability. So it might say how best to communicate with the person. It might say what's going to reduce that person's anxieties in a certain environment. It talks about the things that are really important to that person, and staff would maybe read it, and it would give the staff a better understanding of how to support the person and sort of some of the adjustments that they might need to make for that person. So we're hoping that in the future we'll be able to tell if there's an improvement. So like I said, we get really good data about the number of people on our learning disabilities register already and the uptake of cancer screening programs. So we can monitor that, and we will keep an eye on that, and hopefully we'll see improvements in that. We also do our local leader reviews. So whenever somebody with a learning disability dies, there's always a review done of the care and health support that they received. So we also talk regularly with people with learning disabilities in the self-advocacy groups and family carers to find out how things are working practically for them, and if there's things that we could do to improve on the systems and the processes and the pathways that we have in place. So I suppose to reduce the health inequalities of people with learning disabilities, we need to be working with people with learning disabilities, with their support networks, and everybody else involved really, to make sure people understand